Hey guys, what's up? It's Dr. Heather Moore. Hope everybody had a great Thanksgiving and is getting past the holiday and on to the next holiday. So today we're going to go over do knee injections really work? And I'm going to answer that question that I get a lot. So I'm going to give everybody kind of a second here to tune in, and we're going to go over the big question of do they work and what you can do if it doesn't work. So again, today we're going to talk about do knee injections really work and what you should do if they don't. So the answer to do knee injections work is no. And I know I probably just alienated a whole bunch of people saying that, but they don't. And let me explain why before everyone gets on here and gets upset or comes into the office and says, I had one, it worked great, it never came back. Knee injections work from a standpoint of they're addressing inflammation. So if you go to the doctor for your knee, you have knee pain. So there's pain and then there's inflammation. So you have both. You have pain, you have inflammation. A knee injection will calm the pain down. So it's a big shot of Advil. So in that respect, it works. So I know I've seen many, many times people get excited because they've had this knee pain injection, pain went away. Great, I've paid my $50 copay, my $100 coinsurance, whatever it is, pain went away. You know, I didn't have to have surgery, there was no therapy, it's great. Saved time, saved money, and went on my way. So, no, you didn't. And here's why. When you get an injection to reduce the pain, and I'm not talking about, you know, chicken liver or whatever they're injecting in your joints to hold off a joint replacement. That's a different injection. I'm talking about those cortisone injections or whatever type of anti-inflammatory they're going to inject into your knee, because you don't need, there's nothing on the MRI that shows that you really need any type of surgery, but you're having pain with running, you're having pain going up and down the steps. These are the type of injections that I'm talking about. The others are an entirely different topic altogether. But what happens when you get an injection is you have a sore knee. What is a sore knee? Well, that's the problem, is that when you get an injection, you don't take the time to diagnose it. And I know a lot of people say, okay, well, it doesn't matter. I'm able to run again. I'm able to do all these things that I couldn't do before, and it fixed the problem. It's gone. That's all I need is it's gone. And I know we all want the magic pill, the quick fix. Here's the problem. So what happens is when you just go and you get a knee injection, you calm the inflammation down, you go back to normal activities. Great. You may not feel pain for 6 months. You may not feel pain for a year, all right? In that time, it's going to come back. Like, it will come back. Whether it's 6 months, a year, 2 years later, it's coming back because you never address the problem. Your knee, unless you had a car accident, a fall down the steps, you fell while you were running, doesn't just start to hurt, okay? And if it's not a direct result of some sort of trauma, like a fall, an accident, okay? Running is not trauma, all right? If you get this because you're running, that's not trauma. We'll get to that. But that type of situation, generally, that will clear up. That's inflammation. That's not compensation. When you go to the doctors because you're having trouble going up and down the steps, you go to the doctors because you can't run without pain. For whatever reason, that knee is causing you enough pain to go into the doctor and you get an injection, all you're doing is calming down the inflammation. Nobody knows why you have the pain. Nobody's addressed why you have the pain. And now what you've done is instead of, okay, you had pain, your muscles finally told you you had to go get an injection. Instead of you going and getting an injection, or instead of you finding out the problem, instead of getting an injection, you've put off finding out the problem. So you've calmed the inflammation down, so you're able to do what you were able to do before. Now a year later, 6 months later, you know, it acts up again. Well, now that problem that was causing the inflammation is now 10 times worse. Now this issue that originally caused the inflammation in your knee and caused pain with running is now 10 times worse. So instead of having a problem that if you came to therapy right when you started to have it We could have fixed you in a few visits, given you a home exercise program, been on your way. Now it's months. Now it's thousands of dollars. Now it's time that you didn't have before, but guess what? It's going to demand even more now because you didn't address the problem. Pills and injections are great ways to avoid dealing with a situation, and I know we all want to do that, and that's, that's pretty much how we all operate, but in terms of, are you going to get away with this? No. Is it going to come back to bite you? Yes. Is it eventually going to take you out of things that you like to do? Absolutely. So it's really important that you understand what is your goal. I mean, I understand that when you go and you get a shot, you want to get rid of the pain. Get it. Got it. Good. So if that's your only goal, great. Go get rid of the pain. Get a shot. I think they're going to give you 3 in a lifetime. And then by the time that hits, just be prepared that it's thousands of dollars and it's months of rehab. And it's not as easy as a joint replacement. And it's not as easy as people saying, oh, well, I'm just going to go to therapy for a couple of visits. It's not that easy. When you address a problem from the get-go, it is always cheaper and faster than if you put it off. If you find that you are putting off pain that is more than 2 weeks old and you're taking a pill or you're doing an injection, find the source of the pain. If you treat the pain and the pain only, you are asking for a lot of trouble down the road. And I'm not talking in terms of just from a physical standpoint. I'm talking from a monetary standpoint. I'm talking from a time standpoint. All right? We don't have time to address these things. You're going to have even less time in the future, and it's going to require you to address it. When you get an injection, you are delaying the inevitable. And also, it's not even delaying the inevitable. You're making everything else that much worse. So instead of taking the time now to deal and find the problem, you are creating new problems because the old problems didn't go away. So the old problems now have to find new ways to deal with them because, well, you just got a shot, so it's not inflamed anymore. So now it's calmed down. So now that snowball that was building, because it just all of a sudden your knee started to hurt, that didn't happen because of an accident. It happened because things snowballed over time. Things got worse over time. And this snowball just keeps going. An injection just stops the inflammation. It doesn't stop the snowball. It just stops the inflammation. So I am sure that if you are watching this video, you know someone and you maybe even are a victim yourself of a knee injection, a shoulder injection. You might be on 2 or 3. First one worked great. Oh my gosh, it was magic. I hear that all the time. Oh, it lasted me 2 years. Oh, it lasted me forever. Then I got a second one, it didn't do anything. Or the second one only lasted me, a month. And now here I am. And we reach a plateau and we reach a point where there's frustration and anger because it does take a while. The longer you ignore a problem, just double that time. So if this has been going on for 2 years, don't look for it to get better in 2 weeks, or a month. This has been a snowball that you have ignored for that long. So knee injections don't work to fix the problem. They work to get rid of the pain. And I know people are like, well, that's all I want. Great, you've accomplished that goal, and it will accomplish that goal. But I am telling you right now, it is not taking care of the pain in the long run. It will come back. It will cost you more money, and it will cost you a heck of a lot more time if you don't address the problem. Addressing a problem when you find it and stopping it, way better than just putting a piece of Scotch tape on it. And that's basically all you're doing with an injection, is you are putting off the inevitable. And maybe you're planning on winning the lottery later down the road and quitting your job. So maybe, you want to wait that 6 months or that 2 years and say, you know what, when I win the lottery and quit my job, I'm going to have time to deal with this. But if that's not your plan, don't go in and get an injection and expect for it never to come back and expect for everything to be good. You can get an injection and it can be worse. You can get an injection and nothing can happen. Always, always, always find the source of your pain. If it's not showing up on X-ray or MRI, it is coming from a muscle imbalance, which is where therapists come in. That's why I have a job, is we address those muscle imbalances. And we see it all the time. The problem and the difficulty with the knee is that everything at the foot, ankle, hip, all attach at the knee. So if there's a dysfunction in the muscles in the hip, in the back, that's going to be a problem. If there's a dysfunction in the muscles in the foot, in the ankle, in the calf, that's going to pull on the knee. So when you come in and you have a knee pain issue, we've got to figure out where it's coming from. Knee pain is never knee pain. Knee pain is something going on either in the hamstring, in the hip flexor, a weakness in the glutes, or tightness in the calf, or the way your foot's hitting the ground. There's a reason for that issue, and we need to address that reason. So the knee pain, the injection in the knee isn't going to work because it's coming from the hip or it's coming from the foot. It's not coming from anywhere else but that. So we have to figure out where it's coming from. So if you just shoot the knee up, the knee's like, I don't care. It's not my problem. I'm getting pulled from above. I'm getting pulled from below. We've got to find that problem. Whenever you go in for a diagnosis, whenever you go in for a problem, whether you're getting an injection or not, you got to find the cause. That's the number one thing I will tell you, is always determine a cause for the pain. Because if you don't, your body's going to find a solution for it, and it's not going to be a solution that is going to be pleasant in the long run. Right now, absolutely, it'll save you time, it'll save you money. In the long run, it will cost you thousands of dollars more and way more time than you have. So before you get an injection, before you think that this is the greatest thing ever and you're going to go back for number 2, reconsider. Come in, talk to us, check out what's going on with the muscles above and below that knee. It's coming from somewhere. Find the source of the problem. It really will pay in the long run. It really will save you money and time to address the problem now rather than get it shot up and wait until it goes and you can't run, you can't go up and down the steps, you can't hold your kids, you can't play baseball, you can't do whatever it is you love, because eventually it will take over your life. I promise. I see it every single day. And I get I wish I would have dealt with this 2 years ago. I wish I would have dealt with this when I, first had it. I would have been so much better. You're right. It would have been so much better. It would have been easier. I've never, ever, 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 ever in my 15 years of treating ever had somebody come in and be like, wow, I am so glad I waited. This saved me so much time and money that I waited. I am so glad I didn't address this. There are just tears daily in here of, I should have dealt with this 2 years ago. I should have dealt with this when this came to pass. I should have dealt with this when I was getting injections. I know. And it's a difficult decision to make when it's something you can shoot up and walk away from. But in the end, it's not going to pay. So just be careful when you're getting injections. Make sure you know the cause of your pain. Make sure you know why you're getting an injection. And maybe it's an injection to help with the pain and, some therapy just to, fix the muscle imbalances. Maybe it's a combination. But don't think that pills or injections are going to do you any sort of good. You have to address the cause of the problem. You have to find the cause of the problem. So thanks for tuning in, and we look forward to seeing you soon.